Welcome back to Switzer on Australia's Business Channel. Two new groundbreaking treatments may have been discovered to cure the worst kind of skin cancer, melanoma. With us now is our resident health expert, radio star and award-winning writer, Dr. Ross Walker. Mate, welcome to the show.
Thanks, Marty.
Now, before we get onto this, these groundbreaking pieces of medical research, I've got a question.
Yep.
I got a flu shot 3 weeks ago, and I've now got the flu. What's the deal?
You haven't got the flu, you've got a cold.
I've got a cold, okay.
Yeah. So the flu shot only prevents influenza.
I thought it was false advertising.
No, it's
Dr.
not.
Ross.
No, it's not.
I expected to have nothing.
No, it'll only stop you from getting influenza, which is a serious condition where you get the severe aches and pains, you feel lousy.
Yes.
Often it lasts for a couple of weeks, whereas a head cold or respiratory tract infection, you might have it for a few days, you feel a bit full in the head, a bit of a sore throat, and then it goes.
So basically this, by getting that shot, I've mitigated against possibly having a more severe...
Yeah, influenza. And I've got to say, this year's influenza, there's a 40% increase already in diagnoses of influenza compared with this time last year. The Northern Hemisphere flu, which travels down to the Southern Hemisphere now, has been a really vicious season. So we're in for a very vicious flu season, so I'd advise everyone to get out and have their flu shots now to prevent getting that nasty illness.
So it's not too late now?
No, it's not too late now, but it's not going to stop you getting a cold.
Yeah, okay, so you can't, there's no cold shot, there's only a flu shot.
No, it's only a flu shot.
Right, yeah. A little bit of a deviation.
That's okay.
But medical breakthroughs. Yeah. Skin cancer, a huge killer of people in Australia. Talk us through what's going on in that space.
Well, firstly, you hear all the time, big breakthrough, and then when you drill down on the story, it might be in a rat or a mouse where they've used some treatment that's not available for humans yet, and it may or may not work, and so really it's not much of a breakthrough. This, however, these two major studies for melanoma, but probably for a whole lot of other solid tumours like lung cancer and kidney cancer, bladder cancer, etc., this is a huge breakthrough.
So these have been tested on humans?
Tested on humans. Now, the first one, they used a modified herpes simplex virus, the virus that gives you cold sores, but they changed it so it didn't hurt normal, healthy cells, but when they gave it to the people with melanoma, it killed the cancer cells directly. So it got into the cancer cells, killed the cells. And when they studied these people, there was a very strong response in about 16% of people with end-stage melanoma. It's almost unheard of. And then when they looked at the survival rates for these people, they were about 41 months on average compared with about 20 months in the people in the control group. That was the first study. The second study, which just came out last week in the New England Journal of Medicine, took
American publication?
Yeah, major publication, one of the top journals in the world, took two what we call monoclonal antibodies. Now here's the thing with cancer. The normal immune system looks at all the cells in the body and says, you're healthy, you're not, gets rid of it. But in cancer, cancer develops this shield around the cells to make it invisible to the immune system. What these treatments do, we call them immunotherapy, target the shield and kill the shield so the immune system can then recognise it and get rid of it. Now again, with end-stage cancers like advanced melanomas, the survival rates are pretty dismal. This particular study showed when you use the two therapies together to get rid of that shield, a 60% of the tumours after 12 months had been reduced by a third. Wow. It's almost unheard of stuff. This is serious breakthrough. Now I think the big deal, and they should really think about this, is to combine the altered herpes simplex virus with the two immunotherapies, use that in a big trial to try and just eradicate maybe most of the cancer. So I think we're not far from having a serious cure, even for advanced cancers.
So when we say there's been a breakthrough and it's been tested on humans, does that mean it's actually available in the market now?
This is the problem. That's a great question, because the real problem, Marty, is that these treatments are unbelievably expensive. So what
are we talking about?
We're talking about $100,000 a treatment, and they're a treatment that might go 2 or 3 times a week for a couple of weeks, then have a sustained effect.
So as you said, you do it more than once.
Yeah, you do it over a few weeks. Yeah. But you have to be really in a clinical trial to get the treatment, or governments have to say, look, long-term cancer diagnosis costs the community so much money, we're willing to put the money up front. It's hugely expensive at the moment, But like any new technology, it's initially very expensive. Then the more it's used and utilised, then the price comes down. So that's what we're hoping.
And how much would a government subsidise on those sorts of medicines?
Well, for the monoclonal antibodies, there are some that are on the market for a whole lot of other conditions. So, for example, there's a whole spectrum of diseases called autoimmune diseases. So you've probably heard of rheumatoid arthritis, the very common one, but there's lupus and there's psoriatic arthritis, a whole lot of things where the monoclonal antibodies are showing very, very strong effects. And the government does subsidise those. So something that might cost $20, $30, $40, $50,000 for a treatment, somebody can get it on the PBS.
Yeah.
That's the wonderful thing about being in this country. But because this treatment has only just come out this week, we're talking about $100,000 possibly for one treatment or one or two treatments, and the government's going to wait until maybe a couple of more trials come out to show the benefits.
If you had the $100,000, could you buy it now?
Oh, yeah, sure,
Yeah.
sure.
So it's available for sale.
Absolutely, it's
just
available,
not
it's
backed
tested.
by the PBS.
And mind you, we're not talking about something that has no side effects. Now, the altered herpes simplex virus, minimal problems with that. But almost everyone who had the double monoclonal antibodies still had some side effects from it. They felt tired, they had skin rash, diarrhoea, all of these sort of things. But again, it's worth putting up with those if you're looking at a potential cure for your condition.
And so how long until, so say the government says we're going to support it, how long until it could actually be publicly available at an affordable price? Can these things happen quickly?
Yeah, I think in the next 6 to 12 months. But again, we're talking all the time about the fact that the government's running out of money or has run out of money. And so the question is, where do they put their priorities? But again, if it's your loved one or you who has one of these conditions, you want this. And we're not just talking about melanoma. We're talking about lung cancer. In the same journal this week, a 40% reduction in serious lung cancer that usually takes people off the planet pretty early. 40% reduction. And
why doesn't this stuff get more publicity?
Well, that's why we do these shows, so we can give it publicity.
But this is you'd think that there would be more noise made about it, obviously.
Well, I was on Channel on the Today Show talking about this. I spoke about it on my radio show, so I think there is a lot of publicity coming out in the medical media about this.
Yes.
And we have to keep...
It's front page stuff, isn't it?
Yeah, well, it is front page stuff, and I think it's really, really exciting that we're actually getting these sort of treatments. Now, in my other life, I'm a cardiologist, and we've got extraordinary breakthroughs in cardiology, but not as many in cancer, but I think we're getting there now. This is really exciting stuff.
Ross Walker, thanks for your time.
Thanks, Marty.